gestational hypertension? Common in African American women. Either if they're advanced maternal age or very young, like younger than 17, this is common. So with gestational hypertension, it is high blood pressure that can be mild to severe. The blood pressure elevates in gestational hypertension for the first time after mid-pregnancy without proteinuria. Preeclampsia is the detection of protein in the urine with elevated blood pressure. Eclampsia is preeclampsia with seizures. Hyperemesis gravidarum with hyperemesis gravidarum, this is an intractable nausea and vomiting. Some of these patients would have to be on TPN. We want to monitor their fluid and electrolyte imbalance. Fetal heart variations, variability indicates cord compression. Early D cells indicate head compression. Accelerations are okay. And late D cells indicate placental insufficiency. As it results to fetal heart monitoring. All right. All right, APGAR. APGAR scores. The purpose of APGAR in layman's terms is just to see how this newborn is doing coming into the world, okay? We're gonna note several different characteristics. We're gonna note their appearance. We're gonna note their pulse. We're gonna look at their respirations. And when we look at their respirations, we're gonna be monitoring if they're gonna be having any type of signs of respiratory distress like nasal flaring, grunting, retractions. We're gonna notice their grimacing. Are they grimacing? Are they making any facial expressions? We're gonna notice if they are having, what type of activity are they having? Are they clenched up? What are they doing? Are they flailing around? Are they flaccid? So we want to score these things. A score of 8 to 10 is okay. 0 to 3, we want to resuscitate. A newborn's vital signs. Heart rate is 120 to 160. Respirations is 30 to 60. We also want to look at their head and their fontanelles. We don't want it to be sunken. Sunken fontanelles are no-no. That indicates dehydration. And a bulging fontanelle indicates overhydration. Also, we want to look at their body and look at their different spots and recognize birthmarks, like stork bites or the port wine stain, strawberry marks, Mongolian spots. Mongolian spots typically appear on dark-skinned individuals. These babies grow up, become children, and children have different types of disorders as it relates to their age. A typical childhood disorder is eczema. Eczema is an inflammatory process of the skin. Impetigo. Impetigo is a contagious bacterial infection of the skin. Lice. Lice is an infestation of mites on the hair, and they typically live on the shaft. And we have to use a knit comb and special shampoo. A blood disorder, sickle cell. This is a congenital disorder, common in African American children. The major thing that we want to be mindful with this is to avoid a crisis. There are several different types of crises. However, the most common is a vaso-occlusive. And so what happens here is that the blood cells will aggregate and clump into one area, and that will cause ischemic pain. So pain is very important with these children. However, we want to establish circulation first. So we want to hydrate and then give pain medicine. Very important. Iron deficiency anemia. This is common in children that are milkaholics. Children that don't eat meat or consume a lot of food. They are at risk for this. They're going to have pale skin. They're going to be weak, low hemoglobin. So you want to add iron to the diet. Hemophilia, another type of disorder, blood disorder. And hemophilia is a X-linked recessive trait. This is an X-linked recessive trait where the mother passes it to the son typically. There are two types of hemophilia. You have hemophilia A and you have hemophilia B. Hemophilia A is known as classical hemophilia. Hemophilia B is known as Christmas disease. The difference between these two is what you treat it with. You treat it with the factor that it belongs to. Hemophilia A gets to treat it with factor 8, and hemophilia B is treated with factor 9. Cleft lip, cleft palate. These are congenital anomalies. It's typically hereditary. Main thing that we want to know is avoid aspiration. We want to assess the ability to suck and swallow when it comes to these children. And we want to make sure that we keep suction equipment available. These babies will need large nipples. With the cleft lip repair, you want to avoid trauma to that suture line. So the babies will have to be put in elbow restraints. With the cleft palate repair, these children need 2 surgeries to avoid teeth eruption. Tracheoesophageal fistula. You want to recognize the signs of this. They all begin in C: coughing, cyanosis, and choking. Those are the 3 C's of tracheoesophageal fistula. I guess I can spell it right. On assessment, you're going to see you're also going to see a frothy type of saliva. And they have a tendency to drool. Appendicitis. With appendicitis, it's inflammation of the appendix. The thing that we're trying to avoid here is peritonitis. Peritonitis is caused by rupture of the appendix. So where all the waste gets into the peritoneum. That will cause a patient to be septic, and death can be imminent at that point. A person with appendicitis is going to have pain in the right lower quadrant. They're going to have an elevated white count and all the other signs of infection: fever, chills, restlessness, things of that nature. Celiac disease. In celiac disease, we want patients to maintain a gluten-free diet. When maintaining a gluten-free diet, we want them to avoid foods like oats, barley, breads. Anything made from wheat. Hirschsprung's disease. In Hirschsprung's disease, this is also known as megacolon. And this is a condition to where they will have a failure to pass stool. So these children would not be able to gain weight. They would have abdominal distension, and they will have ribbon-like foul-smelling stools. In intussusception, this is telescoping of the bowel. So they're going to have currant jelly stools. Hepatitis. Hepatitis is a liver condition. Most common hepatitis is A, B, and C. Hepatitis A is transmitted the fecal-oral route. Good hand washing is encouraged. Hepatitis B is transferred through blood and body fluids. And Hep C is the same as B, blood and body. There are vaccines for Hep A and B. There is no vaccine for Hep C. ENT, ear, nose, throat disorders. Meniere's disease. Meniere's disease is a condition when you have an increase in endolymph fluid behind the cochlea. So with that, we want to emerge diuretics, pull the fluid off, maintain a low sodium diet, and we want safety or fall precautions to be implemented because the patient will experience vertigo. Glaucoma. Glaucoma is an increase in intraocular pressure. It's painful. The thing about glaucoma is application of the eye drops. We want to make sure that we occlude the lacrimal duct when we're applying the eye drops. We want to apply pressure there because we want to avoid systemic effects, which would be a drop in blood pressure. Drug of choice for glaucoma is timolol, which is a beta blocker. Cataract. Surgical considerations are at stake. In cataract, post-operatively, we want the patient to avoid any coughing, bending, sneezing, vomiting. So you could expect them to be on some type of like stool softener so they won't strain. You can probably expect them to be taking a cough suppressant if they have a cough, or an antiemetic to avoid the vomiting. And we also want them to patch that eye, and we don't want them to lay on it or apply any pressure to it, right?